Hi, everybody. Welcome to Conversations with Calvin, We the Species. It's a Monday afternoon, June 27th. I'm doing the whole chronological thing. It would probably take me about an hour just to set this particular interview up with Dr. Gloria Bachmann, and it's been being developed for the last 4 or 5 years since I met Dr. Bachmann. Actually, here's the title. Gloria Bachmann MD, Robert Wood Johnson Medical School Professor, OB/GYN, Director of the Women's Health Institute at Rutgers Robert Wood Johnson Medical School, and One Health. New Jersey is the first state in the country to legislate One Health. We'll talk about that. That's why we're here. Which One Health is human health, animal health, and earth sciences combined. So we have a healthier existence on this earth. And this is the best for me, and it's also for Dr. Bachmann. We talk about this all the time, but it was 4 or 5 years ago at the Garden State Film Festival. This is how this all came about. I was there on a Friday night doing my journalism, walking around pretending I was important, and interviewing a few filmmakers, and I'm wearing this hat, this exact hat, and a woman came over to me and asked me if, because of the hat, if I was a Rutgers professor. And at the time I wasn't. I've since been one, but I wasn't, and I always dreamed of being a Rutgers professor. So I said, no, I wish I was. It's nice to meet you. And she just gave me a card, and I gave her my card. And that was the end of that until a few weeks later when I got a call from Dr. Gloria Bachmann. She saw I was a journalist. Would I be interested in doing a story on a lecture they were having at the hospital? And being a card-carrying member of AARP and having lots of time on my hands, I said I'd love to. And that was the beginning of this wonderful journey that I've had with Dr. Bachmann, because a few months later I was installed on the advisory committee of the Women's Health Institute. And I'm not just saying this, Dr. Bachmann, because you're here, but we talked about it before we went on air, but that was transformative in my life, having met you, having been involved in women's health, because it opened up such vistas and such areas, and literally transformed a whole part of my life and my journey, having met you. And as we become great friends, we also discovered, and I love saying this, we also discovered this one other element that you're laughing.
I was going to bring this up.
And you know what? You can tell that story. And actually, I'm done with my Johnny Carson monologue. Not a lot of humor, but good stuff. You take it away. How about if we start with a little bit of a bio, and of course, that linkage that we share that is priceless.
The linkage that Calvin is talking about is we actually met as very young individuals when we both were in Newark, New Jersey. And Calvin was working at his uncle's pharmacy, Comashane's, and I was a regular customer there because they sold everything that anyone in the neighborhood would need, want, or have to have, except groceries. And so as Calvin and I were talking, we realized that we actually go back much further than just the evening that we met at the Garden State Film Festival, and that we do have ties back to our young adult years. So it's really been an amazing journey.
Yes.
To connect with Calvin again. Yes. And to share a lot of the memories of our Newark neighborhood where he worked and I lived.
Right. You know, that not for now, but I mean that whole and I know that Harry Comershane, my uncle, whose picture is right over there, I stare at him every day. He was such an exceptional, an old-fashioned but exceptional, wonderful druggist that in part kind of influenced you. And you know, I'm kind of spiritual, and I have his picture up there, maybe in part because you told me that you were connected. So I threw his picture up on my wall there. So and I have to just say, this is so, what we're doing here is just the beginning and we'll get to One Health in a minute, but the world is changing and the environment and so much is changing, and people need to know about these initiatives and these things going on because it's life. It's their life, and they have to know what's going on and have to contribute. And that's the purpose of this, because we're going to be doing more with so many more people involved in One Health. My job as advocacy and outreach is to throw this out there and try to grab some people and pull them away from TikTok for about a half hour. And that's why we're here. It's a beginning of a journey. So a little background. Dr. Bachmann, a little bio, and then we'll kind of jump in.
Well, we're talking about our historical pasts, and I want to also mention that when I was a young person, my first position, and we're going to talk about One Health, my first position was at Turtleback Zoo. And what I learned there was that we are all connected, that my health is related to every other animal's health, is related to plant health, is related to the environment. And I really got firsthand viewpoint of that while I worked at Turtleback Zoo as a zooette. So I haven't really deviated far from that path of really seeing that we can't look at ourselves in isolation, that I can't look at Gloria Bachmann to say my health is just about me, or Calvin Schwartz can't look at himself and say his health is all about him, but about everything that we interact with. And let me give you one example of that is antibiotics. That if I take an antibiotic for a cough and it's not necessary, what I'm doing is I am changing the bacteria in my lungs, in my respiratory tract, to make them superbugs so that they will become over time immune to that antibiotic. And therefore, when I do need that antibiotic, it may not work for me. So these are just little examples of how One Health is so important, that my health is related to my microbes in my body, related to the pets that I live with, to the environment that my home is in, to the toxins in that area. And that's really where one of my great passions is to move the One Health initiative. And I've been very fortunate, and Calvin knows this, to work with Amy Pappy, who has been instrumental in moving a first in New Jersey. New Jersey is the first state to have a One Health task force. And what that means is we're going to be bringing together multiple disciplines for a collaborative approach to how best to optimize human health by optimizing animal health, by optimizing our environment. And no one person has all the answers. No one person.
Let's talk about more. We'll come back to women's health in a little bit, but let's, while we're on One Health, defining it, and my understanding, and it's the focus in putting together humans, plants, and animals, and in looking at the whole ecosystem, correct?
You know, it's very, very interesting, Calvin. The person who actually started the One Medicine is a veterinarian, and he almost shares your same name. His name is Calvin Schwabe, SCHWABE, instead of Calvin Schwartz. And what he did as a veterinarian, he put it in a veterinary textbook in 1964. He said there's so many similarities between animals and humans, and he stressed the importance of collaboration between veterinarians and physicians to help solve health problems in all of us, not just in humans, but in our pets, in our livestock, in the animals who inhabit the forests and the jungles, in the sea and the ocean, so that there is a link between all of our health. And that's what One Health, or planetary health it's sometimes referred to, is where you see all the intersecting circles, that I can't be healthy unless the animals on the planet are healthy, unless the other humans are healthy, unless our crops are healthy. And that really is the focus of how can we do that?
Mhm.
How can we reverse some of the toxic changes that we've made and really bring them to a positive change to enhance health rather than just detract from our health?
Wow. As we said before we went on air, talk, talk, talk. We all need to do more talking and talking, and the outreach, and people need more and more until that pendulum, that balance ticks over, and we're all really talking about this. And yes, Amy was so, and I'm so glad I met her, and worked with her on in the committee. There's so many different things to consider with One Health. Antimicrobials and climate change and food. It's just it's over. I mean, it's overwhelming. Right now it's New Jersey, but you're now going regionally.
Yes, we are. And I just wanted to bring up one other aspect of the health, and I want everyone who's listening to think about it. But let's even think about humans and how we've changed our own microbial organisms that live on us. We all, that's why some of us take probiotics, because we want to keep the microbes on our body healthy. We don't want those resistant ones that have built up a resistance to penicillin or streptomycin or another medication. But in time since modern day, babies were born how? How were babies born? They were born through the mother's birth canal. And they got all of the microbes from the mom. Then think about what happened next. Then next, the baby was fed by being nursed by the mom. So there was that skin to skin contact. And there was also the microbes that were associated with that skin to skin contact and the nursing. And then what happened recently? And again, there's good parts to this. And I'm not saying it's all bad, because there are many, many women who did not make it through childbirth because we didn't have all of the modern interventions that we have now. I'm not saying that, but I'm saying that things have changed. So what's changed? Now there's many babies who are born by surgical incision, which means that, and how many of you have been in an operating room? It's a totally sterile environment. So there's no bacteria, there's no microbes, or minimal. So that before the mom has the surgery, the C-section, the abdomen is scrubbed with a solution to make it sterile. The baby comes out through a sterile environment, is put on a sterile incubator, and that baby may be bottle fed. Now, of course, there's a formula for shortage now, but basically, many babies go right from a C-section delivery, which is sterile, to bottle fed. So where's the mom's microbes? Where is the father's microbes when the father holds the baby close to him?
Wow.
So we've changed the microbial flora, the environment of that young infant. And can we get it back? We don't know. So that's really a major question that has come up as to just these simple things that are being done today. What effect will they have? And again, many individuals need a C-section, and that's not an issue. The issue is, then how can we get those microbes to the baby? And many moms can't nurse, and that's not a problem. But how can we get those microbes to the baby? And so there's more and more emphasis on who we are, who Calvin Schwartz is, who Gloria Bachmann is, may be dictated by the microbes that are growing on our body. And we want to keep them as healthy as possible. We want to keep the animals around us as healthy as possible. We want to keep the environment. And it may start with our own body and how healthy we are with our microbes. So just little things when you think about them and how things have changed over time for the better, because the maternal mortality was horrific in the past. Moms bled to death. Moms had arrested labor, which means they couldn't get the baby through the birth canal. So we've taken care of that, but then we've caused other problems. So what a One Health task force will do is it will say, okay, how can we bring all of modern science together? How can we move healthcare ahead for everyone, not only for humans, but for animals, but for plants, for our environment, but at the same time, make sure that we do keep the fundamentals of health alive and well.
Brilliant.
Yeah.
Brilliant. And I guess it began in 2016. You had a little committee at Rutgers, and that's how some of this energy got born. And it really is. It's beyond. I read recently that we've lost here in North America, several billion birds. Well, why? There's got to be a health issue. Why those birds aren't here? An environmental, a health issue. And then I saw Amy Pappy's posting the other day about lantern fly. It's a predatory insect. We don't think about these things, but that's all One Health.
Yeah, that is all One Health, Calvin. And what's interesting, and again, I'm not saying it's bad, but here's how science progresses, but then what are the effects of it? How many individuals, if they have a lawn near their house or with their house, how many control weeds with some type of So again, that will also affect everything that's living on that grass. And I mean, I'm not saying that this is the right thing to do, but maybe we should have a patch in our backyards where we just let it go to a natural habitat for the worms, for the birds, for the bees, and not use so much of the herbicides, pesticides to keep our lawns green and beautiful. Because, and again, I'm not saying either or. It's just these are things that we have to think about, because in life there's a cause and effect of, and you have to say, okay, let's weigh what are the positives and what are the negatives when we're talking about One Health, and how can we preserve the environment. And as Calvin said, how can we preserve the birds? How can we preserve the honeybees? How can we not have a massive influx of lanternflies and things that may destroy a lot of the natural foliage in the area? And these are the questions that a One Health task force would address, because it's not just for one discipline. It's for those that know about insects, those that know about birds, those that know about humans, those that know about, dogs and cats, those that know about vegetables, fruits, plants, those that know about the environment, weather. So it takes everybody sitting down and saying, how can we best move ahead so that we assure the health of our planet? And that's why a lot of people are embracing the planetary health name, because it's our whole planet. It's not just New Jersey, it's not just the United States, it's not just North America, but it's the whole earth.
Funny, that's why when I came up with a name, when I started this channel conversation with Calvin, I sat there August 2020, and I wanted to come up with a name, and it just hit me right away. It actually was deep thought to come up with a name, and it's kind of like One Health. I call it We the Species, conversation with Kyle, we the species, because the pandemic taught me that there isn't a spot on this earth that's safe from COVID. From Antarctica to, to Stuyvesant Avenue in Newark. There's no place that's safe. And then the other thing occurred to me, that we really are one species. And there was a great movie with Cher and Nicolas Cage called Moonstruck. And one of the great scenes is Cher slaps Nicolas Cage in the face and says, "Snap out of it." And that's it's what we have to do is slap a whole bunch, because we are one species, just like One Health. And I came up with the we the species because we are one species. So it's just, it's it's just a demonstration of what One Health is. And
Yeah, and what I want to emphasize is exactly what you just said, Calvin, is we have to come together. And I want all the listeners to think about how we came together with COVID. That we had a crisis, a global crisis with COVID. And many individuals lost their lives, and many are continuing to lose their lives, but not at the same rate when we were first hit with this pandemic. And what did the world do? The world got the best manufacturers, the best pharmaceutical manufacturers to come up with a vaccine that would protect individuals from COVID. There's nothing that's absolute. There's nothing that's absolute. I'm sitting in my office and the ceiling can fall in. Doesn't mean it's going to happen. It could, but it's highly unlikely. And that's what happened with everyone coming together and producing a vaccine that has protected so many individuals. So that during the height of the pandemic, so many individuals were coming into the hospital and dying from COVID. And many of the floors that were used for other reasons, for those individuals who are coming for diabetes or other things, they were converted to COVID floors because we had so many patients with COVID. The entire hospital was in lockdown for visitors, for loved ones. And it was a very difficult time that if I had COVID, no one could come visit me. I was isolated in an area, maybe on a ventilator, and my loved ones couldn't see me at all. So it was a total pandemic that affected people in so many ways, that almost everyone was affected. You either knew someone or a loved one, or even just a distant relative you heard that either died from it or became very sick. My own brother became very sick with it. Wow. So what happened? We came together and we said we have to find some way to ameliorate. We haven't eliminated it, but to make it less virulent. And obviously there's many ways to do it, but one way was with the COVID vaccination. So when people come together and work together globally, that we get so much further than if Calvin and Gloria work together on a project and we isolate ourselves. That we have to really depend on holding hands with the team and bringing in ideas, bringing in expertise that we don't have. That Calvin has a lot of expertise I don't have. I have expertise that he doesn't have, but we don't have everything together. So we really need each other. And I think that's, if I would say the one thing that One Health means to me, it's a 4-letter word, TEAM, team.
That's great.
That you need a team. And you don't have to be a senior member of the team. You just have to be part of the team. And that really is, I think, what represents One Health to me is, and the One Health Task Force is being part of a team where everybody has the same vision, like everyone had the same vision to stop the pandemic, the COVID pandemic. And there's been many other pandemics. There's been many other problems that have affected humans and animals, and coming together is really the best way to come up with solutions or how to ameliorate the situation.
Team.
I mean, you can even think of seatbelts that way. I remember the day where we didn't belt up. And then we saw that with just a simple seatbelt,
Yeah,
that you can avoid major trauma.
correct. It's funny, I was in an accident in 1973.
Really?
My car rolled over on Mizell Avenue in Springfield. It rolled over 4 or 5 times. I was going rather fast. I was a kid. And there were no seatbelts. There were no seatbelts, and the car was completely crushed, and I walked out. There wasn't a scratch on me, but point being, there was no seatbelts. Within my lifetime, I've seen seatbelts and other things. Anyway, yes, so the purpose of this is to get to members of this One Health Steering Committee. But I get such a kick. The last steering committee of the One Health, listening to veterinarians and professors and doctors and in so many different persuasions, and my wife always said, you're kind of a journalist, and I said, but I'm part of it because everybody has a purpose. My purpose is DL. And I'm good at that, and that's the emphasis, the essence of One Health. Everybody's contributing to the common. It sounds great. It's right out of the 60s, common goal, but it's really true. So,
And you know what, Calvin? You also need cheerleaders.
Yeah,
Because what do you have at games, at athletic events, at football games? There's cheerleaders there, and I think you need cheerleaders. So there's those that are actually, performing, doing, and then you have everyone who's there to support, and you have the cheerleaders who are saying, you have to give your support. And I think that, and I'm using it in a very positive way. In fact, my own son was a cheerleader, so I went to many a game to watch the cheerleaders as well as the game to watch my son cheer. So he was a college cheerleader, and I think that all of us in life can be cheerleaders and can really make sure that we support in a vocal manner, what's near and dear to us and what's near and dear to society, the betterment of society.
and we are a function. It's funny, I worked for 25 years for the second richest Italian in the world, Leonardo Del Vecchio, an amazing man, and he used to lecture us, and I spent 25 years there. But he always said, keep repeating, keep cheering, keep repeating, because this thing between the 2 ears needs constant reinforcement until it finally sinks in. So 7, 8, 9, 10 times, keep repeating, keep cheering, as you said. And then eventually, so that's what One Health is. We got to keep cheering and getting it to sink in until people understand. So it's work to do.
Yeah.
So a segue now. In the last part of this, just a quick overview of the Women's Health Institute, how, where, when it was born, and I listen on Tuesdays, every Tuesday. I don't miss these meetings. It's great to listen, and the speakers. So talk about One Health Institute, how, where, when.
Women's Health Institute is part of Rutgers, and it was born at Robert Wood Johnson Medical School, and it really has a couple of purposes. One of the purposes is to move health ahead, especially women's health ahead, for community outreach, for looking at ways we can improve women's health through research, through clinical trials, through doing research, even looking back at journals many, many years before us to see what was done then, what made a difference, and how can we improve on that difference. And basically really training the next generation who are following us so that they can be contributing members of society. And we do a lot with the healthcare team. So it's just not, physicians, it's nurses, it's PAs, it's public health, it's all of us basically that can move health ahead. We also do a lot with those who really don't have a voice. When we talk about cheerleading and have a voice, many individuals don't have a voice. So we're also doing a lot with incarcerated individuals, with individuals upon reentry. And I ask this to everyone. I'm going to ask this to Calvin. Calvin, if you had been away for 2 years, and I said, Calvin, I haven't seen you in 2 years, and you were in a prison, what would you tell me?
Well, I tell you, I want to know what's going on. And can you help me get back into the world? I need help to get back into the world.
Most people are embarrassed to say that because they feel that someone will just turn them off if they hear that they've been in prison. So that's another, we have to stop all of the stereotypes, and anyone who's been in prison should be able to say, I've been in prison and now I'm back in the community and I'm a contributing member of the community. So the Women's Health Institute is doing a lot with incarceration and reentry. We're doing a lot with veterans, that many veterans have post-traumatic stress, that have mental health issues, and we really want to move that. We're doing a lot with maternal health, that we still have very dismal statistics on the number of individuals who get very sick with pregnancy or who pass with pregnancy, and they never, we recently delivered a mom that never got to see her baby.
Wow.
That she passed because of severe COVID. So we don't want that to happen. We don't want, and especially Black moms have a much higher rate of maternal morbidity and mortality, which means they have more complications and more moms pass, and same with infants. So the Women's Health Institute does a lot with maternal health. We work with the New Jersey Black Women Physicians Association, and we work with First Lady Tammy Murphy on Nurture New Jersey, so that we can really move maternal health to as safe as it can be for all mothers, regardless of where you live, what your background is. We want the best outcomes. So maternal health is also another major area that we work with, and aging, menopause, that many times individuals would be told you're over the hill because you're 72 or you're 75 or you're 80 or you're 85. And I go back to, and I'm sure everybody heard this, my mother taught this to me, age is just a number. I know, Calvin, were you taught that too?
Oh yeah, I live it, breathe it.
Age is just a number.
I'm 3 years from 80.
Yes, and it's the person that some of us, have no hair. Some of us have bushy hair. It's who you are. Some people like, I need glasses. Other people don't need eyeglasses. Some people have intolerance to gluten. So we're all different, but by coming together, and it comes back to the TEAM team, we're a team. And the best way for our own self and for our family, for our community, for our loved ones, is to really embrace the team, embrace each other, not only for our similarities, but for our differences as well. And I think that's really the message that the Women's Health Institute brings to the learners, is we can all be part of a team, regardless of our background, what our strengths are, what our weaknesses are, if we have common goals. And the common goal is to improve society, to improve the health of all of us, and to make sure there are no barriers that are put up for individuals, such as what we just talked about, incarcerated individuals who would be denied a lot of the privileges that many of us have. And a shout out to the New Jersey Reentry Corporation, under the leadership of former Governor James McGreevey, there are so many reentry services now that are being made available for these individuals so that they can get a bank account, they can get a credit card, they can get an ID, they can get job training, that there's not a wall that is put between them and their reentry into the community.
Wow, and that's all the banner of women's health. I'm always so fascinated when I, during school season, just to listen to the diversity of speakers, and one of these days I want to hop in on an interns meeting and the diversity of research that you're doing. But I want to go back because I took a particular interest in this, and I promoted it in my own little world. The Maternal Health Awareness Journal, 2022, and I still promote it. I throw it up for people to see, and I get lots of, when we're off air, I do a lot of stuff on LinkedIn, and I love LinkedIn, and it's a powerful communicator. And I did a 3-hour seminar last week on LinkedIn and how to use it and maximize it, and I shouldn't be doing those things at 77. I mean, I'm way past, the purpose of LinkedIn. I know.
No. Age is just a number.
I know. So I took that seminar, and then they give you and this is really cool. They give you a link, and LinkedIn, with their algorithms, they watch everything you do. It's like Big Brother, my goodness. I clicked on that link, and it evaluated my performance and what I do and the connections and the impressions I get when I promote things, the whole Calvin package on LinkedIn. And I'll share you the link, but I'm in the top 2% in the world.
Congratulations. And I'm not surprised.
And my effectiveness on LinkedIn, it blew me away because I had no idea that an old guy is in the top 2% out of 400 million in the way I use LinkedIn. But anyway, the purpose why I tell you this was, I had been promoting this, and I still promote it. I throw it up there, and it gets 400 or 500 impressions, views. But this is, it's so great because I just to go over some of the things that were in there in this first edition to 2022, bringing healthcare to the underserved. I mean, simple things that you don't think of. Home blood pressure monitoring. I have a cuff in every room in the house because I'm on OCD. This just blew me away. Autistic women pregnancy experience. I mean, I didn't even know that existed. And wow. And I know Rutgers was one of the country's pioneers in the whole world of autism and the things they were doing. And it's like, wow. Lack of healthcare in the third world countries for expectant mothers. But, just comments on this. Brilliant.
Well, that's also something that started with the Women's Health Institute as well. We were on the leadership team that actually started the Maternal Health Awareness Day, which is now going national. And it really is for stop, look, listen. And what do I mean by stop, look, listen? That any individual who is pregnant or has just delivered should be able to say, and again, I'll just say I am the pregnant person, that I have a headache, and you're the clinician, and I say, I have a really bad headache and I'm about to deliver in 2 weeks. So you have to stop whatever you're doing and say, tell me about it. Look at me, make sure that I'm not tremoring or anything like that, and listen to what I'm saying. Because a lot of times, if you're just said, oh, well, everybody gets a headache, then I may have an adverse event such as toxemia of pregnancy, where I start to seize and I have high blood pressure, and the blood pressure was causing my headache. So we really were on the leadership team that started the Maternal Health Awareness Day, so that every family unit with the pregnant individual knows that everything should be reported and an answer to everything should be given that's satisfactory. that you should not just assume because you're pregnant, just forget it. That if you think it's a concern or a question, report it and make sure that it's evaluated, that you're looked at, you're examined, and that something is done if there is a problem that's identified. Not, oh, go home and with rest your blood pressure will get better. No, you come into the hospital and make sure your blood pressure doesn't get worse while you're under the care of the healthcare team. So that was really one of the big initiatives that we've started. And the journal was in celebration of that, where we had the Women's Health Institute interns contribute to the journal and their perspectives on maternal health. So it really has been a very important area in what I do as an obstetrician gynecologist. That's where I was trained. I trained at the University of Pennsylvania, where I was one of the very fortunate individuals to train under a Black OBGYN pioneer, Dr. Helen Dickens.
Wow.
And she was the first in many areas. And when she trained, it really was almost all men in OBGYN. And she was one of the first women and one of the first Black women to be in obstetrics and gynecology. And I not only worked with her, under her, actually, she was the attending doctor as a medical student, but I stayed at Penn for residency, and I got the honor and the privilege to work under Dr. Helen Dickens for 4 years. And just as I said before, team is part of One Health. If I had to say what was the most influential person in my life and in going into OBGYN and doing what I'm doing, it would be Dr. Helen Dickens, who truly showed me that you have a vision, you follow your vision, and you do everything that you can to do whatever you can to make the world a better place.
Wow. You know, you're talking about, I showed you this before we went on air, just so people can quickly see the depth and the grasp and the reach of the Women's Health Institute. But you had one of your interns create an app to fight maternal mortality, Zoe Reich, and here's a star ledger. She developed an app to fight more. I mean, and that was a year ago. I saved this for a whole year to show you. That's, you know, but anyway, that's the depth of what you do, and the talent that's there at Rutgers, and the creativity, the innovativeness, and you know, you inspire me. Again, I'm not stroking or you just do, and you have lifted me up. So this is kind of a good time to. One other thing you're doing, I thought was really cool. You and Dr. Hutchinson Cullis are going to a big conference in October, breast self-care, and I thought that was kind of neat to mention. That's coming up. And of course, I see Dr. Hutchinson Cullis all the time as well, you know, in these meetings, which are fabulous. So this is a good place just to do a temporary wrap, because this we can go on and on and on, and we will, and especially with other members of One Health, to bring them to a stage and bring the team, and for the team to chat. So thank you, Dr. Bachmann, for your time.
Calvin, what I'd like to say, and again, you have social media presence, but if anyone would be interested in some of our publications and our pamphlets, would it be okay if they contacted you to let you know that
anybody you can spread the word? Listen, I sit here and I got to take a picture of my chair. I sit here 15 hours a day in this chair for the last 3-4 years, and I'm here, and people can contact me. I would love that. Truly,
And we would love to share the Women's Health Institute with you, the publication that Calvin showed you. We really would love you to get involved in your support. And even if you just want to read some of the stuff that we do,
Yeah.
we welcome you, because again, if you're listening to Calvin, you're part of the team, because he's part of my team.
Thank
And
you.
I'm very privileged and honored
Thank you.
that we met again after a hiatus of many, many years between the pharmacy that his uncle Comashane had to when we met at the film festival. So,
And by the way, it's all because of this hat.
Yep.
I praise this hat. And really, I could lecture, and I did lecture students when I taught at Rutgers, how important it is to come up with something, a brand, because it's powerful. And so I came up with this idea 11 years ago, and I'm grateful every day that I had it on, that you saw it.
that's right. That's why I went up to you.
Yes, it's great stuff. So this is all to be continued. We got lots of more people to bring here and chat with. And thank you so much, Dr. Bachmann, for lighting my fire. That's a Jim Morrison song. You lit my fire and it burns brightly thanks to you, and to be continued. So thank you, thank you, thank you.
Thank you for having me.
Okay.
Bye-bye.